how would you characterize the overall health of the community? What geographic and or demographic areas are at risk?
There's a concept or a description of health that has been widely discussed really around the world, and it's something that we call the gradient of health. And the gradient of health is the premise that our health improves as our income improves. And it's not just from the most wealthy to the least wealthy, but it's truly a gradient where health improves with the wealth of the individual or the community. So it's not just one group that we want to think about who's in so much need, but it's really a framework or a context that we need to look at across our community, not just assuming we fix it because we fix one little problem over here or a group of people over here. But we need to think about it in terms of the whole community. To the geography, yes, there are concentrated areas. We think about East Knoxville, South Knoxville. I was sharing that I recently moved to South Knoxville. My life expectancy based on my zip code dropped about by 6 years. So where I was previously living, the projected life expectancy was about 6 years greater than where I'm currently living. So I'm really trying to live life to the fullest now. We also have areas, it's not a simple, there's not simple lines. We have areas that we call, that we can describe as concentrated poverty. It's based on areas where the population is greatly or in the majority have lower education attainment, low income, and those communities where there is concentrated poverty they have less resources. There's a little bit less of the cushion that can absorb and help people to experience some of the true impact of poverty. But on an individual level, if you're living in poverty, you're living at a stress level way beyond the person who is not living in poverty, and that's one of the other factors in this gradient of health.